Are you a psychologist, counsellor, therapist, coach or wellbeing practitioner who wants to learn about acceptance and commitment therapy? Well, I want to tell you about a taster training session coming up soon. My name is Jim Lucas and I am an ACT therapist, supervisor and trainer. And I specialise in helping CBT practitioners integrate ACT into their toolkits. Why? Well, I believe that ACT can help you to be a better therapist. For many clients, the last thing they want to hear you say is, have you thought about accepting your difficulties? The thought of spending the rest of their life anxious or depressed is too overwhelming. It feels hopeless and despairing. Why should I accept it? I came to see you because I want to get rid of it, they say. Are you telling me that you can't help me? Practitioners often dread these moments. We can't bear the experience of being unable to help. It disturbs us and shakes us to the bone. We try to avoid it at all costs by working hard and nudging the client forward to do more exposure or experiment, only to hear that the following week that the homework did not go to plan. We may get sucked into the story of why it wasn't possible. We offer validation and look for more assumptions or core beliefs. If only we could get to the root of the problem, we'd be able to help them stop avoiding life. ACT can help you when you don't know what to do. People are mindy, and clients spend a lot of time lost in thought, worrying and ruminating. They quickly justify their reactions, blame others for what they experience, or give themselves a hard time for failing to improve. They get stuck in loops that send them on a downward spiral, or they feel easily overwhelmed when they try to get on with life. It's a torturous back and forth between fear and shame. And it can feel unclear for the CBT practitioner who is used to following protocols. What problems do we tackle first? Which diagnostic intervention should I follow? Traditional CBT invites you to learn many diagnostic templates. It's not easy remembering them all, and you can quickly get lost when your client wants to address all their problems at once. There's a simple alternative solution. Acceptance and commitment therapy is one model. You can use it whatever the client's presenting difficulties. You needn't learn many different procedures because ACT focuses on a common set of behavioural processes that occur across psychiatric diagnoses. Since the 1950s, the DSM has significantly increased the number of possible diagnoses. More disorders are available to us now than ever before. Do we need all these new possibilities? In my experience, we do not. An acceptance and commitment therapy gives you and your client a simple way to understand their distress and develop specific skills to help in life. Many CBT protocols offer solutions to eliminate anxiety or depression. However, they don't provide anything once those so-called symptoms have decreased. ACT is a model for the human condition. So in other words, you can use it to help people when they struggle or get stuck. How does that work? Well, acceptance and commitment therapy combines 6 interrelated behavioural processes that shape people's well-being. And when people get stuck, they struggle and suffer because they've learned to rely on specific actions. It's not to say that people are to blame for their suffering. Of course they're not. We're human, and we all set out to do our best. It doesn't help to assume it's our fault because we don't choose to feel scared, sad, or guilty. It simply happens. Our job is to help people see how they get stuck and teach them skills that set them free. ACT targets multiple dimensions of experience, including your relationship with emotions, thinking, attention, the self, motivation, and habits. ACT recognises that when we target how we relate to these dimensions, we can liberate our minds and build a significantly more fulfilling life. Let me give you an example of how ACT addresses problems with thinking. Traditional CBT advises us to rewrite negative automatic thoughts to reflect a more accurate or helpful truth. ACT offers an alternative approach to dealing with beliefs. ACT suggests that the problem is less with the form of thought, but linked more to the relating pattern. For example, when a person gets too close to their mind, taking thoughts literally or following them without awareness, they allow their mind to control their activity. And so ACT teaches people to step back from their mind's chatter, help let go of unhelpful thoughts. And it's called cognitive diffusion. And we don't achieve it by restructuring thoughts. We apply experiential exercises to thinking so that a person can improve their awareness. And people learn to put unhelpful thoughts aside and then focus their energy on doing stuff that makes life more vibrant and meaningful. In other words, we use mindfulness and acceptance to help people sustain better habits. So what else does ACT do? Well, ACT uses many techniques to help clients increase psychological flexibility. Psychological flexibility is the term used to describe the complete set of 6 behavioural processes. We help clients let go of excessive emotional control, build openness to experience, and take small steps outside their comfort zones. They learn to guide their attention where they want it to go, to minimise getting lost in thought about their past or the future. We help clients identify unhelpful views of themselves so they can use alternative perspectives to move their feet. Clients often get stuck when they have a fixed view of themselves. For example, I'm weak or defective or unlovable. In traditional CBT, we would seek to loosen the attachment to these core beliefs. In ACT, we do something similar, but it's more of an awareness intervention than a cognitive one. We help clients to be curious about alternative views and add them to their consciousness. Instead of wrestling with core beliefs, we help clients to notice that they're more than one thing. The more familiar you are with ACT, the more you learn to harness the power of flexible perspective taking by drawing on relational frame theory and self-compassion. In ACT, we call it self as context, which is highly influential in helping people to change their behaviour. One of my mentors and a well-known and popular ACT trainer, Robin Walser, says, "We help people to live from the feet up, not from the head down." We encourage, nudge and support people to start acting differently, quickly. The ACT therapist assumes a stance that sees people as being complete and capable. We take the risk that they can accomplish extraordinary things. Even though people may believe that they are broken or powerless, we take a compassionate view that anything and everything about their difficulties makes sense once you know their history. The ACT therapist shows a client that change is possible, and we help them build a kinder, braver approach to their experience and life by believing in them before they do. The ACT model invites practitioners to embody psychological flexibility. We model it to clients, ask them to do something new, and give them bags of reinforcement when they experiment. Personally, I love the ACT approach because it combines the power of CBT's behaviour change techniques and the heart of the humanistic therapeutic alliance. Rooted in behavioural analysis, ACT draws on long-standing behavioural principles. It's a truly modern approach that looks at experiences and activity in context. It's a humble, curious, and bold psychotherapy that suits our progressive age. So if you would like to learn more about ACT, come to the next taster session. I'll give you a brief overview of the model, its principles, and how you might integrate it into your toolkit to help people improve their health, well-being, and relationships. Take care and see you soon.